just a quick look in Robert's mouth once more before we insert anything. Make sure everything looks relatively healthy. There's no sore spots from the previous denture perhaps. Everything looks pretty good. Okay. So we'll start with the maxillary try-in. Get you to open for me. And nice and relaxed for me there. A little bit of pressure, just kind of jiggle it into position, make sure it's nice and secure to where we want it to be. Just kind of check for any rocking here, any rotation. There's nothing there. And I'm putting pressure in the front. That's pretty good. Just like we had last time, nothing has really changed. So I'm just going to raise Robert here a little more closer to my eye level so I don't have to hunch over and ruin my back. The appearance here already looks pretty good. He's got a nice full appearance and nothing is really protruding out in terms of the labial contour. And get you to open a little bit for me, Robert. And just as I'm looking in his mouth now, I can see a hint of the upper teeth there. All right. Now, give me a smile for me. That looks pretty nice. But I have to say, I see more tooth here than I see a little bit here. I might have to bring this lateral down a little bit and maybe rotate the 2-1 a little lower into occlusion. But overall, it looks pretty nice. So I'm going to double check with the Fox plane. For the plane of occlusion. So once again, we're just going to place it over the teeth and assess how it relates to the interpupil line. That looks pretty good. And to the allotragal line, that looks pretty nice too. So you can see here up against the Fox plane that the lateral, the 2-2, is a little higher than the 1-2. And I think that's what's throwing things off. But other than that, I think we look pretty good. So everything looks into plane. All right. Anything hurting you, by the way?
No.
Forgot to ask you, but from your reaction initially, it didn't appear that it was. All right. So everything looks pretty good. And we want to get a nice look down the patient's down the buccal corridor on each side. Kind of part the lips equally and to see how everything kind of lines up in your mind's eye. That looks okay. And here's the moment of truth when we insert the lower denture, because now we're able to assess a lot of things. Oh, one thing I want to mention before we move to the lower. As I'm parting the lips here, I'm assessing Robert's midline, and that looks pretty good, relatively in the middle of his face. Now, if you're off by a smidge one way or another, it's not the end of the world. If you're about 0.5 millimeter or so, but it's when you deviate more than 1 millimeter, closer to 2 or 3, and it's quite noticeable at first glance that the midline is quite misaligned, that, you know, it requires you to reset the whole thing. So we'll get that nice and easy in there, let that settle right back here. Any pain there, Robert?
No.
You might feel a little roughness on the inside because the little piece flaked off of the wax, but that's going to get replaced, okay? So don't worry about that. So from here on, I'm going to get you to relax for me, Robert, and close with both sides. Open again, relax, and slowly close until you first touch. Now, at first glance, you're hitting there early, right?
Yeah, and right.
Okay, good. All right. We're going to correct that in a second.
Okay.
I'm just going to get you to settle a little bit more. Now, this time around, I want you to relax your jaw, close your eyes for me, and concentrate on biting down with both sides. Open again, relax for me, close until you first touch. Open again. So we're going to do this a few times because initially you might think you're correct or incorrect, but we're going to let Robert relax a little bit and close for me, Robert, one more time. Open again. So this time around, what I want you to do is just concentrate on biting down with your back portion of your mouth.
Okay.
Go ahead and close. That was the front portion. Okay, open again. Relax for me. Right, so what you did there was this movement here, right? I want you to stay nice and relaxed and bite down with your back teeth. Another technique that we can use here is get you to open, give me a nice smile, and close. As the patient is smiling, we're asking them to close. Open, close, good. How does that feel now?
It's
Still early on that one side?
Yeah, just a little bit, and it's just a little uncomfortable right here.
Right here. Now you mentioned that last time, so it
Yeah.
could be just a little overextension on the outside there. So we'll take care of that.
Okay.
All right. So the bite looks pretty close. If it's a very small difference, sometimes it's just best to leave it, and then we'll just grind it in once the dentures are cured. Once we have them in the acrylic stage. Okay. If it's a significant difference, then we can do a check bite and I have to reset the whole case.
Okay.
All right. So a couple more things I'm going to check here, Robert, before I give you the mirror and for you to take a look at. I want you to lick your lips for me again. Just look out in the distance. Take a big breath and out your nose and relax. Good. Let your jaw hang just enough. Let it hang. Right. And just exchange air through in and out of your nose. So I'm going to move your lips, but I don't want you to move your jaw. Don't open and don't close. Nice and relaxed for me. Relax, 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 relax. So there we have about 2 to 3 millimeters of freeway space. So we're going to do that again for everybody. Take a big breath and out your nose and relax. Good, good. Lips lightly together. There we go. Okay, so at this stage, Robert is just resting. If he's about to fall asleep or watch TV or he's reading a book, and right now we shouldn't have any contact between upper and lower teeth. So once again, Robert, I'm going to move your lips, but don't open or don't close any further than you are right now. Stay nice and still. And we have about 2 millimeters of freeway space right there. So the teeth are not touching each other. Another way we can assess the freeway space, Robert, what I'm going to ask you to do is count from 60 to 70, 60, 61, 62, and so forth. But before you do, what we're looking for here is that we want to see some kind of clearance between the 4s and the 5s primarily, because that's probably as far as we can see inside the buccal corridor. So between the 4s and the 5s, we're looking for that 2 to 3 millimeter freeway space, and we don't want any contact with posterior teeth as Robert is going through the sounds. All right, so go ahead from 60 to 70.
60, 61, 62, 63, 64, 65, 66, 67, 68, 69, 70.
Good. Okay, so we have some incisal contact coming together, but not so much posterior contact. Now the sounds are gonna seem a little bit different to you, primarily because you haven't had a lower denture, right?
Yeah.
So your muscles have adapted to you not having a lower denture, so you've adapted it to making the sound the way that you want to hear it. Now that we introduce so much stuff in your mouth, things are have to change a little bit, and that takes a little bit of time.
Okay.
Okay. So if it sounds a little bit awkward to you now, it will change over time. Okay. One thing I want to point out here too, in terms of the vertical dimension, if I can get you just to open your jaw a little bit. Now, if you look in here, we just see a hint of the lower incisal edges. So we don't have this effect where everything is hidden or everything looks like super erupted. So as has his lips relaxed right there, open slightly, Robert, we see a hint, not sure if you can see it on camera properly, open just a bit more, just a hint of the lower incisor showing right there. Just a small grin for me, Robert, a little more, there we go. Just a little more grin, good. So right there, that 2-2, again, it looks a little bit short, so I'm gonna have to bring that down into the plane of occlusion, and everything looks pretty good. If you use just a closer look here, Tyler. Look at me this way a little bit, good. Keep smiling just like that. Relax your lower lip and grin again. There we go. So the lower lip should end up meeting the upper incisal edges. And that's very important because in order for Robert to make certain sounds like F, so if you say Frank for me,
Frank.
So the lower lip has to meet up the upper incisal edges in order for him to say that. Okay, lick your lips for me. Swallow. Good. Just a gentle grin for us. Relax your lower lip. I know you're kind of tensing a little bit in your lower lip, but that's okay. That's okay, it'll come. So I'm going to give you the mirror, and I'm going to show you what I've been looking at for the past 10 minutes. And I want your intake on this. Tell me what you think. So this is a very common reaction for patients to do what Robert's doing now. He's over-flexing his lower lip because he wants to look at everything, and that's okay. Okay? But in all probability, Robert, so instead of doing this, I want you to just, there we go. Just relax your lower lip. You can lean your hand back for me, just like that. We'll get a little more light in here. What do you think in terms of the color?
Good.
You like the color, right?
Yeah.
I don't think it's too dark, and I don't think it's too light for you. I think it's just enough. And just if you count from 1 to 10 for me, and while you do that, I want you to see the amount of tooth that's showing while you're counting from 1 to 10 in the mirror.
Take these off too.
Yeah, let's take these out. We really don't need those in there anymore. Thanks, Tyler. Thank you, Rob. Just wait for me. All right, so go ahead and count naturally from 1 to 10.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Okay. All right, so it's just enough tooth showing. Give yourself a big smile now in the mirror. So no matter how much you're trying to exaggerate or lift your upper lip, if you look in the mirror, you're not gonna have this look, that gummy look.
Cool.
Okay?
Yeah.
So because the tooth is really high enough, I've selected a tooth that's high enough to accommodate your smile. So basically what you want to see is teeth. We don't want to see gums, right?
True.
Granted, sometimes if we get really excited and hear something really funny, ha ha ha, we might get a little bit elevation with our upper lip, but 90% of the time, you're just gonna get a nice grin like that, and that's all you're gonna see. Now the only thing I wanna fix is this side tooth here. So the second one from the middle, it looks like it's too high up a little bit. You see it? And I see a little bit of a space right here. So if you open a little bit, right there, I wanna bring it down a bit.
Okay.
Sounds good to you?
Yeah.
And we'll try it back in.
All right.
Now that you've had a chance to wear them for a little bit and be a little more relaxed with the bases, what I'm gonna do is check the bite again. Get you to open again. I want you to relax. Relax for me and close with both sides. Open, relax, and close until you first touch. Now, try to close with both sides because I can see you kind of wiggling your...
Just the way my jaw goes.
I know. And the fact that you haven't worn a lower denture.
And no, my jaw it's at a hinge.
But, so you kind of, okay.
See.
But from right there, open slightly. Don't open too much, just a little bit. Relax your jaw. Good. Close a little bit, hold it there. Open a little bit, right there. Now slowly close with both sides. Open, relax. Now, so I'm tentatively holding the lower in until you first touch. Do you still feel the right side touching first versus the left?
Just a little bit.
A little bit, right?
Yeah.
Okay. Let's try that again. Relax for me again. Close your eyes for me and concentrate on biting down with your back teeth, both at the same time. How about that time? Open, slowly close. I feel like you're coming together at the same time, but you have a more sense of what's going on in your mouth right now.
Yeah.
In terms of visually assessing things, it looks like you're coming together at the same time. I feel like you're coming together at the same time, but you feel a little earlier on the right side,
Just
right?
a little.
Okay, now we could go ahead and take a check bite at this point, but we could throw things even worse, throw off things a little bit worse.
And the upper plate,
Yep.
way in the back,
Yep.
digging into my gum.
Okay, the upper here.
Yeah.
Okay, so there may be a bit of an overextension there.
Yeah, on the inside part though, not the outside.
On the inside?
Yeah.
Okay. Open for me again. Relax your jaw. So this is very important, so we're going to take our time assessing this. Now right there, if you can see, Robert just deviated all the way to the right side. So I want you to just relax with both sides for me, Robert. There you go. Slowly close until you first touch. Open again. Slowly until you first touch and stop. Right there. So I see a bit of an opening on the left side and a little premature contact on the right side. So what I'm going to do, I'm going to remove some of the back teeth and we're going to do a check bite. Okay, and that'll give us your true biting position. Right now it's closed, but if we leave it like that, you're always going to be fighting with the teeth, trying to get into the natural chewing position. Okay, so it's very important that the teeth match your natural chewing position. They're close, but they're not there yet. Okay, but the only difference is I'm going to leave the 4s on, the 3-4 and the 4-4, to maintain the vertical dimension, and remove the last 3 teeth on each side. And we're going to inject some of the material last time. Very simple. It'll take about 15-20 seconds to set, and then we'll capture the new bite, hopefully. Okay, let's try that again. Relax for me again. Close with both sides. Open, relax your jaw, and stop. So when you first touch, I want you to stop. Good. Okay, but before we do that, I'm going to adjust the tooth on the upper and just see how that looks, okay? I'm gonna remove this over here. Okay, great.
Okay. Right here. Right here.
You found the little pressure spot there?
Yeah.
Okay. Can you, let's see in your mouth where you found that. Relax for me. Was it out here?
Yeah.
Right there.
Yeah.
Okay, so you got a little bony protuberance there. That's a little more sensitive than anything else. I'm
Yeah.
going to show you guys on the model what Robert is feeling here. And in all probability, we're just going to relieve that a little bit when we finish the denture so you won't feel it.
Okay, cool.
Okay?
Yeah.
And I'll show you how that relates to the model. Right there.
Yeah.
There's a bit of a ridge there.
Yeah, yeah.
This is on your upper right side. Right there, so we can get a little light in here. That's exactly what you're feeling right there.
Yeah, it is.
Okay? Okay.